On the eve of vaccines and antivirals, there are a number of people who have been infected with COVID-19 who have quickly recovered and returned to their everyday lives. On the other side of that global equation, there is also a growing number of people who continue to face long-term health effects that far surpass normal recovery time. This is the new normal brought on by long COVID, a term that has recently been used to describe the prolonged symptoms of COVID-19 that some people can experience after recovering from a confirmed case. Long COVID is now more than just a term, but now also a moniker given to people who suffer the long-term effects lasting months or even years following a bout of COVID-19. More than just a name, medical science has categorized long COVID as a phenomenon of lingering symptoms, with the notoriety gaining recognition internationally, commensurately garnering numerous questions about what differentiates it from the original virus. The answers are inconclusive. The cause of long COVID is still not well understood, and unfortunately, there is no known cure at this time. But the common denominator among long haulers are the symptoms that include but are not limited to fatigue, nausea and vomiting, significant difficulty in thinking and concentration, headaches, joint pain, and chest pain. Furthermore, some patients may experience respiratory symptoms such as shortness of breath and new onset of asthma-like symptoms. Despite the fact that long COVID is becoming increasingly common, it still remains a largely misunderstood condition. An average of 27% of patients with long COVID experience reduced quality of life and are in need of specialist medical care to support them through this long-term process. It is estimated that at least 10% of COVID-19 survivors experience long-term effects of the virus. There is no clear-cut definition or classification of how long COVID manifests itself and no concrete treatments or cures. It is imperative to take a preemptive and proactive approach in order to detect and prevent long COVID. Currently, most treatments consist of specialized physical therapy, cognitive behavioral therapy, and mental health services to help ease short-term and long-term effects. In addition, many long-haul COVID patients are turning to alternative treatments such as supplements, vitamins, and herbal treatments to help with fatigue and pain. The coronavirus pandemic has had an immediate impact on the global health crisis. If there was a lesson that we learned, it is that the long-term effects of the virus highlight the importance of taking preventative steps to protect ourselves, such as wearing a face covering and washing our hands regularly. Furthermore, it is critical to get tested if you experience any symptoms of COVID-19, as early detection and treatment are key components to successful long-term recovery.